Hello, everyone. My name is Candice Acuff. Myself, Annalise Bowen, Tara Gloystein, Eugene Micheline, and Kenneth Wu are a group of medical students at Wayne State University School of Medicine who will be talking to you about falls prevention and taking a stand to prevent falls. During this presentation, you will learn why falls prevention matters, your risk factors for falling, reducing your risk for falls, so exercising to improve your balance and strength, reviewing your medications, having your vision and hearing checked, making your home safer, talking to your family, what to do if a fall occurs, and lastly, evidence-based falls prevention programs that are available to you to help reduce your risk for falls.
Check your risk for falling. So first, we would like to start off with a small activity with a series of 12 questions where you can just answer yes or no. So if you have time, please find a pencil or paper near you and we can start. So question 1, I have fallen in the past year. So why does it matter? It is because people who have fallen once are likely to fall again. These people might be experiencing symptoms such as muscle weakness or imbalance, which cause their fall. And without intervention, a fall is likely to happen again. Question 2. I use or have been advised to use a cane or walker to get around safely. So why does it matter? It's because people who have been advised to use a cane or walker may already be at an increased risk for falling. People around you who are suggesting you to use some type of walking assistance may be observing symptoms on you that you may not be aware of, such as unsteady gait. Question 3. Sometimes I feel unsteady when I am walking. So why does it matter? It is because unsteadiness or needing support while walking are signs of poor balance, and poor balance is a major risk factor for falling. Question 4. I steady myself by holding onto furniture when walking at home. So why does it matter? It is because it is also a sign of poor balance. If you require holding onto a furniture to stabilize yourself while walking, you are at an increased risk of falling when that support is taken away or no longer available. Question 5. I'm worried about falling. So why does it matter? It is because people who are worried about falling are more likely to fall. These people are likely experiencing symptoms of leg muscle weakness or unsteadiness while walking, which is the reason for their fear of falling. Question 6. I need to push with my hands to stand up from a chair. So why does it matter? It is because this may be a symptom of a weak leg muscle, which is a major risk factor for falls. Question 7. I may have some trouble stepping onto a curb. So why does it matter? It is because this is also a sign of weak leg muscles. If you are unable to lift your legs properly, you are more likely to trip over objects on the floor or the curb. Question 8. I often have to rush to the toilet. So why does it matter? It is because using the bathroom at night when your visions are poor increases your chance of bumping into objects or furniture, thus increasing your risk of falling. Question 9. I've lost some feelings in my feet. So why does it matter? It is because numbness in your feet can lead to stumbles and falls. A loss of feeling in your feet can cause unsteady gait or imbalance, thus increasing your risk for falls. Question 10. I take medicine that sometimes makes me feel lightheaded or more tired than usual. So why does it matter? It is because side effects from medicine can sometimes increase your chance of falling by increasing fatigue or blunter awareness to your surroundings, making it more likely for you to trip and fall. Question 11. I take my medicine to help me sleep or improve my mood. So why does it matter? It is because these medications can sometimes increase your chance of falling by increasing your drowsiness or reducing your alertness. Question 12. I often feel sad or depressed. So why does it matter? It is because symptoms of depression, such as not feeling well or feeling slowed down, are linked to falls. This is likely due to reduced attentiveness to your surroundings. So that concludes the end of our short activity. If you scored 4 points or more, you may be an increased risk for falling. The good news is that most falls can be prevented and you have the power to reduce your risk.
Okay, so now we're going to talk about why falls prevention matters. I'll start with some statistics about older adult falls. So, an older adult falls every 1 second of every day. 1 in 4 older adults reported a fall back in 2014. So, of course, this data is a little older, but it does help you get a picture of why this is so important. And then the number one cause of hip fractures. So falls are actually the number one cause of hip fractures in older adults. More than 7 million of those falls require medical treatment or restricted activity for at least one day, and more than 27,000 older adults died as a result of falls. That's 74 older adults every day. So again, why does this matter? Falls are a leading cause of both non-fatal and fatal injuries among older Americans, particularly people aged 65 and older. Falls result in more than 2.8 million injuries treated in emergency departments annually, including over 800,000 hospitalizations and more than 27,000 deaths. Falls, with or without injury, also carry a heavy quality of life impact. Fear of falling can result in limiting activities and social interactions, and this can result in further physical decline, depression, and social isolation. So next, I'm going to discuss your risk factors for falling. There are several types of risk factors that you should be aware of, and most falls result from a combination of risk factors. They include physical risk factors such as changes in your body that increase your risk for falls, behavioral risk factors such as things we do or don't do that increase our risk for falls, and then environmental hazards in our home or community. So all of these risk factors can increase your risk for falls, and most of the time, these risk factors do overlap. Risk factors also fall into two different categories. So you have non-modifiable risk factors and modifiable risk factors. Non-modifiable risk factors are risk factors that you have no control over. These include things like your ethnicity, your age, your gender, and your family history. All of these things are things that we have no control over and things that we cannot change. Modifiable risk factors, however, are risk factors that you have the power to change. So these include things like physical activity. So increasing the amount of physical activity that you get every day can help to decrease your risk for falls. Your home environment. So how are things set up around your home and how does that affect your mobility? Your vision. So if you're noticing a decline in your vision, using visual aids such as glasses and contact lenses can help to decrease your risk of falls. Medication use and adherence. So some medications may have effects on your balance. Making sure that you properly use and adhere to your medication schedule can improve your risk of not falling. Having a fear of falling. So speaking with someone about your fears and getting over your fear of falling could also help to decrease your risk of falling. So social isolation is one of the modifiable risk factors that does increase your risk for falling. So this includes not interacting with others, not having conversations about your fears, just things like that that can continue to increase your risk for falls. Weakness, again, can increase your risk for falls, and so, again, improving your level of physical activity, strength training, things like that can greatly improve your chances of not having a fall. And improper use of assistive devices. So if you are using devices such as walkers or a cane or crutches or anything like that, just making sure that you are using these devices correctly can greatly decrease your risk of having a fall. Next, Annalise will be talking about tips and exercises that can help you to reduce your risk for falls.
So now that we've identified specific risk factors for falling, I'm going to discuss ways in which you can reduce your risks, such as wearing proper footwear, standing up slowly, exercising to improve your strength and balance, checking to see if your medications make you susceptible to falling, and how to make your home as safe as possible. Before we get into specifics, let's address some common misconceptions about aging and falling. Myth number 1 is that muscle strength and flexibility can't be regained. As we age, we do lose muscle. However, a certain degree of that strength and flexibility can be restored through exercise. Becoming active now can contribute to a healthy lifestyle and benefit you in many ways, including protecting you from falling. Myth number 2 is that if I limit my activity, then I won't fall. Staying home and limiting your activities does not prevent falls. You actually lose strength and range of motion this way and have a greater likelihood of falling. Therefore, it is important to remain as active as you possibly can. While it's not completely possible to prevent a fall, exercises that focus on balance and strength training can reduce your risk of falling. I'm now going to walk you through a few exercises that can hopefully help improve your balance and build strength to help prevent future falls. This first exercise is called the sit to stand exercise. It helps build leg strength and improves body mechanics and balance, which are all very important in reducing falls. You start by sitting on a sturdy chair, making sure that it won't slide or roll out from under you. You should be able to sit comfortably with your feet flat on the ground. Have a sturdy support surface in front of you, such as a countertop, so that you can reach to it for support if you start to feel unsteady while standing. Scoot forward so that your bottom is positioned at the front of the seat. Next, lean your chest forward over your toes, shifting your body weight forward. Squeeze your glute muscles and slowly rise to a stable standing position. Slowly sit back down to the starting position and repeat this exercise 10 times. The goal is to not use your hands at all, but if necessary, place your hands on the arms or seat of the chair and push through your hands to help stand and sit. You should ideally perform 10 repetitions twice a day. For an even more advanced version, you can hold hand weights to add resistance. If you have any pain in your knees, back, or hips, please discontinue the exercise and talk to your doctor or physical therapist. The next series of exercises helps if your balance is unsteady. Make sure you have someone with you in case you lose balance. To begin, stand in a corner or have a kitchen counter in front of you to reach out to in case you start losing balance. Start with your feet apart, about shoulder width apart, eyes open, and hold steady for 10 seconds, working your way up to 30 seconds. If you find yourself swaying or reaching for the wall or counter frequently, just keep working on this exercise until you can do it with minimal swaying or support. Once you can hold this position firmly for 30 seconds, move on to the next exercise. For this exercise, stand with your feet together, eyes open, and hold steady for 10 seconds, working your way up to 30 seconds. Once you can do this exercise for 30 seconds with minimal swaying or support, move on to the next one. The next one is standing on one foot with your eyes open and holding steady for 10 seconds, again working up to 30 seconds, and then you can switch to the other foot. If you can perform the first 3 exercises safely and with little support, try to do each one with your eyes closed. Hold for 10 seconds and working up to 30 seconds. The goal for each exercise is to start with 10 seconds, progressing eventually to 30 seconds, doing 5 repetitions 2 times a day. So now that we've talked about specific exercises that can help improve your strength and balance, we're now going to discuss the importance of reviewing your medications to prevent falls. Some medications have side effects that can make you sleepy, dizzy, or unsteady. You should discuss your medications list with your doctor or pharmacist to see if any of them apply to you. Antidepressants tend to have the biggest impact, increasing your risk of falling up to 68%. Antipsychotics and sleeping pills also increase your risk by over 50%. Anti-inflammatory drugs and opioid painkillers are also medications that you should be cautious of while taking. It's important to be mindful of the certain medications you're on and the side effects they can have so that you're more aware when you become sleepy or unsteady. Another way to reduce your risk of falling is by taking care of your vision and hearing. It's extremely important to get your vision and hearing screened annually. Poor vision makes you less likely to see objects in your way, especially slight changes in the flooring, such as from carpet to hardwood that can easily be tripped over. For these reasons, it's important that you are wearing the correct glasses or contact lens prescription strength. In addition, hearing loss makes people less aware of their environment, so they don't notice other people, pets, or activities going on around them. It can decrease spatial awareness, so being able to gauge where your body is in relation to objects around you gets trickier. Finally, hearing loss can cause the brain to use more resources for hearing and interpreting speech and sound, so fewer resources go towards gait or balance. These factors can all make patients with hearing loss more likely to lose their balance and fall. Unfortunately, hearing loss in the elderly, although very common, often remains untreated, and even those with hearing aids may not wear them regularly. Many patients use them when going out, but not while at home or doing daily activities like making dinner or doing laundry. For this reason, it's very important that you wear them at home, even when nobody else is around. Now I'm going to pass it on to Tara, who's going to continue talking about ways you can specifically reduce your risk for falling.
At this time, we would like to give you the chance to take a short break if needed. All you have to do is hit the pause button on the video, and once you return, hit the play button and we will resume shortly. Thank you so much for joining us.
Another step in reducing your risk for falls is keeping your home safe. There are a few simple and inexpensive changes you can make in your home to help lower your fall risk. We will focus on a few of the recommendations illustrated in this graphic, but first I want to discuss how to start the process. There are many hazard checklists available that can help you begin the process. They generally guide you through your home, room by room, and help you identify potential hazards. The CDC brochure Check for Safety is one of such guides, and I included the link to find it. This particular guide guides you through your home to identify hazards and also makes recommendations to fix that hazard. For example, it will ask you, do you have throw rugs on the floor? And the recommendation will be to remove the rugs or use double-sided tape or a non-slip backing so the rugs won't slip. Another example is, do you need some support when you get in and out of the tub or up from the toilet? And if you identify with this question, the recommendation would be to have grab bars put in next to and inside the tub and next to the toilet. Additionally, good lighting is key in all areas of the home. Make sure you have adequate lighting in the hallways, stairways, and outdoor walkways. Also, an area that is often overlooked is lighting next to your bed and along the path to the bathroom. Make sure the light near the bed is easy to reach. If you have to get up in the middle of the night, you can easily access the light to improve your visibility. Also, if the path from your bed to the bathroom is dark, consider adding a nightlight so you can see where you're walking. Some nightlights automatically go on by themselves after dark, so you do not have to worry about turning them on. Also, be sure to remove clutter and keep your walking paths around your house clear. Give yourself a clear path up and down stairs by making sure things like shoes and books are not left on the steps. Also, rearrange furniture so that it works well with the flow of traffic. These simple steps can help eliminate tripping hazards. To reduce the chance of a fall during daily activities at home, move your most commonly used household items within reach. For example, in the kitchen, keep items that you use every day, like plates, glasses, or seasoning, on the lowest shelves. This will help you avoid using step stools and chairs. Make sure you wear shoes that fit well and do not wear socks without shoes on smooth floors. Also, install grab bars in key areas. You can put them outdoors near your front steps, in the hallways, and anywhere you feel you need a little extra support. This brings me to the next step, which is to talk to your family members and friends. You can enlist their support to help you identify and rid your home of potential hazards. A common fall myth is I don't need to talk to my family members or my healthcare provider if I'm concerned about my risk of falling. I don't want to alarm them, and I want to keep my independence. But in reality, fall prevention is a team effort. Bring it up with your doctor, family, and anyone else who can help. They want to help you maintain your mobility and reduce your risk of falling. Like I said, falls prevention is a team effort. Your falls prevention team should include family and friends, an occupational therapist, your primary care physician, and a pharmacist. Like I previously said, your family and friends can provide some extra hands or another set of eyes to check and eliminate fall hazards in your home. Occupational therapists can also help by ensuring your assisted devices fit your needs and also assessing your home to identify modifications that can prevent falls. Since your PCP sees you regularly and knows your medical history, they can recommend evidence-based programs designed to reduce fall risks, as well as identify and treat any medical conditions that may increase your risk of falling. It is important to tell your doctor if you have fallen recently, felt unsteady on your feet, or are worried about falling. Your PCP can help you reduce your falls risk and stay healthy. In addition, your pharmacist can review your medications and screen for fall risks. They are able to counsel you on any side effects you're experiencing from medication and can optimize medication therapy. Now Kenneth is going to talk about what to do if a fall occurs.
If a fall occurs. Although we wish no one would need to experience a fall, it does occur, so here we will go through things to do after a fall. First, do not panic because it is not constructive for your situation. Calm yourself down by taking several deep breaths and assess the situation and determine if you are hurt. Check if you are bleeding or if you might have a fracture. Next, call for help or assistance if needed. If you are unable to get up on your own, call for someone in close proximity to assist you. If you are alone, try to locate the nearest phone or some means of contact to call for help. Next, seek medical attention right away if you might have hit your head. Sometimes bleeding may occur within the skull and may not present with any symptoms until it is very severe. Severe cases may lead to death, which is why it is important for you to get checked if you might have hit your head. Next, after a fall, revisit the location where you fell and scout for things that increases your chance of falling. Risk of falling can be greatly reduced by simply removing hazardous items such as boxes on the floor or by addition of handrails where needed. You may also want to learn how to get up safely after a fall. You may want to use the furniture as support or your arms to prop yourself up instead of relying on your legs alone. Lastly, follow up with your doctor after a fall to discuss about fall prevention. This may include physical therapy to strengthen your muscles or alterations to your medications to remove medicines that may be increasing your risk of falling. Next, Eugene is going to walk you through evidence-based falls prevention programs.
So these next few slides are going to list some evidence-based fall prevention programs. Some of these, as you'll see, are local, and these are all programs that have been shown to help prevent falls in older adults. The first one is called A Matter of Balance. Now this is actually one that's available locally. It's an 8-week intervention program that emphasizes practical strategies to reduce fear of falling and as a result help increase activity levels. The next program is called Capable. This is a 5-month program, but it takes place at home and is delivered by an occupational therapist, and it aims to help decrease risk of falls, improve safe mobility, and help you accomplish your daily tasks. The next two include Stepping On. This is a group program that helps older adults reduce their fall risk and improve quality of life. And this is a program that's actually listed by the CDC as an evidence-based program. The other one, which is also listed by the CDC, is called the Otago Exercise Program. This is an in-home exercise program delivered by physical therapists similar to one we recently discussed. And it incorporates tailored balance and strength programs, so it takes into account your strengths and weaknesses to give you a well-suited plan. And it's a 12-month program that involves 7 phone calls and at least 7 home visits. The next 2 are called Bingo Size and Fallscape. Bingo Size is a more interesting one. It's a 10-week program that combines bingo-like games with exercise and health education, and of course combining bingo with many of the lessons and the exercises helps make it fun, familiar, because it's done in a group setting, so older adults will be more comfortable in participating and they'll achieve better results. The next one is called Fallscape, and this is a customized program for anyone who's experienced a fall or regular loss of balance, regardless of their walking ability, medical condition, mobility, cognitive or fitness levels. So this is aimed at a more diverse, more broad scope of participants, many of whom can definitely benefit from this program. The next 2 are programs that revolve around Tai Chi, which is a Chinese form of martial art that has been shown by evidence-based studies to help older adults prevent all sorts of issues like falls and arthritis. The first one is actually available locally. It's called Tai Chi for Arthritis, and this is a program that helps people with arthritis to improve muscular strength, flexibility, balance, stamina, and so on. And another program that also revolves around Tai Chi is called Tai Chi Prime. This is a 6-week class series proven to reduce the risk of falling, and the classes include instruction in Tai Chi and Qigong basics, home practice, and exercises embedded into activities of daily living. The next one also revolves around Tai Chi. It's called Tai Chi Quan, moving for better balance. Similarly, it revolves around Tai Chi. The next one is called Fit and Strong, and this is an evidence-based program that involves changing physical activity and behavior, and has been implemented very successfully in multiple community-based settings. Participants that are encouraged to join are older adults who have lower extremity joint pain and stiffness related to osteoarthritis. The next 2 programs are called Stay Active for Independent Life and YMCA Moving for Better Balance. The first one focuses on developing strength, balance, and fitness in adults 65 and older. And the second one is a 12-week instructor-led program that incorporates elements of Tai Chi and can help those as young as the age of 45, but who have previously had falls. The next one is called Enhanced Fitness. This is a local program, or it's locally available. It's low-cost, evidence-based group falls prevention, and it's a physical activity program developed for older adults. It's packaged into 4 key areas, which is low-impact cardiovascular, meaning it's not going to strain your heart too much. It's dynamic static balance work, which means it'll help you balance in movement and in standing still, as well as strength training and stretching. The next one's called Pisando Fuerte, which means stepping strong in Spanish, and it's simply a Spanish version of the program we discussed previously. It's called Stepping On. The next 2 involve False Talk and Healthy Steps for older adults. False Talk is an individual program for anyone who's experienced a fall or loss of balance, and Healthy Steps for older adults raises awareness on falls prevention and introduces steps to improve health and reduce falls before they even happen. Finally, the last one we'll end this list is one that's available locally. It's called Walk with Ease. This is a program that aims to offer relief from arthritis and help to increase activity levels by teaching participants how to safely make physical activity a part of their everyday life so that they can continue being active. The workshop includes meeting once a week for 6 weeks at different locations, and this program is one of the many evidence-based programs that's been shown to help prevent falls. For more information on any of the programs I've mentioned, including any additional ones that you'd like to look for yourself, you can visit the website that I linked right here on this slide. There are various programs. You can always pick one out that's you find best suited for your needs, and ultimately many of them are evidence-based and have very promising results for anyone who's at risk of experiencing falls.